I'm Professor Chaufour, head of the Vascular Surgery Department in Toulouse, and sharing my experience with our cardiac colleagues in Toulouse. Chief is Professor Marchex, and we have been working together for long years now, and we have developed all our funds together to promote research and publication and push some young surgeon to a university career. And I was wanted to share how we take care of extended aortic disease such as Marfan dissection or big aneurysm extended from ascending to thoracoabdominal aorta. And we always study the case together, and after discussing the comorbidities and with sharing the result with the anesthesiologist, we decide what kind of surgery we can offer to a patient, considering the disease and the CT analysis. And we always push for the best result for long term, but you have to consider the comorbidities. So we varies from open surgery with a large experience with frozen elephant trunk repair, and but still we manage doing arch endo or thoracoendovascular, complex TIVA or BIVA. So we mix open and endovascular and try to offer the best solution to our patient. Thank you.